Okay, for my newborn assessment, first I'm going to look at the posture of the newborn. There should be flexion at the elbows, hips, and the knees. I'm going to look at the proportions, and the newborn should be proportionate. I'm going to look at the symmetry, and it should be symmetrical on both sides, and the face should be symmetrical when the baby is crying. Next, I'm going to go ahead and listen to the heart sounds. I'm going to listen at each spot for a full minute. I'm going to find the point of maximum impulse, and I'm going to listen there for a full minute and count the heart rate. The heart rate should be 120 to 160 beats per minute, and it should be at a regular rate and a regular rhythm. Listen to the breath sounds on the front and the sides. I'm going to do that for a full minute in each spot as well. Let's do the sides. I'm going to look and I'm going to count the respirations. And it should be 30 to 60 breaths per minute. I'm going to look at the skin overall, and it should be the color should be consistent with the ethnic background. Acrocyanosis of the hands and the feet, so bluish coloring is normal in newborns. I'm going to look at the front for any birthmarks that we would need to note. I'm going to go ahead and turn the baby over, and we'll look at the back for any birthmarks that we would need to know. The skin should be soft and flexible. The hands and feet might be a little dry and peel if it's a post-term baby. I'm going to assess the skin turgor by pinching it, and it should go back to flat and normal. I'm going to look at the head, and I'm going to move it back and forth, and side to side. I'm going to go side to side and up and down for a range of motion. I'm going to go ahead and measure the head at the brow line. So I measure the circumference at the brow line of the head. Okay. I'm going to go ahead and palpate the head at the fontanelles. And they should be flat and smooth and soft. I'm going to look for molding and any cephalhematomas. The hair should be soft, smooth, and silky. I'm going to look at the face. And I'm going to draw a fake imaginary line from the eye to the top of the ear. And they should be in line with each other. I'm going to do that on both sides. I'm going to feel that both the ears, and there should be no cysts, lesions, or nodules on them. And if you pinch the ears, they should go back to normal. I'm going to check the hearing with a clap. I'm going to look and see if the nostrils are equal sizes, and they are in this baby. With my gloves on, I'm going to look at the lips and the mucous membranes. The lips and mucous membranes should be pink and moist. Alright, so I'm going to look at the lips and the mucous membranes. I'm going to go ahead and check the patency of the nose. So I'm going to put my finger in its mouth, and I'm going to occlude one nostril at a time, and make sure that they're still breathing. While my finger's in their mouth, I'm going to check the hard and soft palate. I'm also checking the sucking reflex, and I'm looking to make sure the uvula is in the midline. The tongue should also be in the midline and be free moving in all directions. I'm going to go ahead and take off my gloves. Okay. Next, I'm going to be looking at the eyes. They should be moving in all the directions. The cornea should be clear. The sclera might be a bluish in the newborn. And with my pen light, I'm going to look at the pupils, and they should be equal in size. They should be round and reactive to light and accommodation. So I'm going to go ahead and look at the eyes. Okay. Next going to check for a rooting reflex. So I'm going to stroke the cheek, and the baby's head should turn towards the stimulus, which it did. Next, I'm going to look at the neck, and I'm going to separate the skin folds and feel for any swollen glands. Okay, I'm going to next feel the clavicle, and they should be straight, indicating that there is not a break, which there is not. Next, I'm going to look at the chest. I'm going to watch the baby breathe, and the chest should have a bilateral expansion. I'm going to look at the breasts, and they should be flat with symmetrical nipples. Next, I'm going to measure the chest circumference, and I'm going to measure that at the nipple line. And the chest should be about 2 centimeters. The chest circumference should be about 2 centimeters smaller than the head circumference. So I'm measuring at the nipple line. Next, I'm going to measure the nipples. Okay. And then while we're here, I'm going to go ahead and measure the baby as well, the length of the baby. So I'm going to start at the top of the head. And you go from the top of the head to the heel, and you make sure the foot is fully extended out when you're measuring that. Next, I'm going to move to the abdomen. I'm going to go ahead and look at the abdomen, and a rounded abdomen is normal in newborns. I'm going to listen to the bowel sounds in all 4 quadrants, and I'm going to listen for a full minute in each. Okay, I listened to a full minute in each. Next, I'm going to go ahead and palpate the stomach in all 4 quadrants. Okay. Now I'm going to look at the umbilical cord, and it should have 2 arteries and 1 vein, and it should not have any bleeding on it. Next, I'm going to feel the radial, brachial, and femoral pulses, and they should be palpable, equal, and bilateral. So I'm going to go ahead and feel the brachial pulses, and then the radial pulses, and then I'm going to feel the femoral pulses. Okay. Next, I'm going to go ahead and move to the genitals. You're going to do this with your gloves on. So in newborns, the gender should be clearly defined. In males, the penis, the penis should be slender in appearance. You want to look at the urinary orifice and make sure that the urethra is at the tip of the penis. If the baby is not circumcised, the foreskin would adhere to the glands of the penis. If the baby is circumcised, you'll want to check for any signs and symptoms of infection. You'll want to next look at the scrotum skin, and it can be loose and hanging or tight and small. It should be a normal skin color, and then you'll want to feel the for the testes, because they should be descended at birth. So you'll want to note if they're both descended or not. In a female, the skin on the vagina should be normal skin color. The labia majora should cover the labia minora in term and post-term babies. The clitoris is normally larger in a newborn. The urinary meatus and the vaginal orifice should be visible. And a bloody or mucus discharge is a normal finding. Next, we're going to look at the anus. So I'm going to go ahead and flip the baby over. So the buttocks should be symmetrical. You'll want to check for anal patency by stimulating the anus, and it should flex. And then the first bowel movement should be 24 to 48 hours after birth. Okay, I'm going to take off my gloves now. Now that the baby is laying on its stomach, you can see the back. I'm going to look for back symmetry. And then I'm going to also look for any more birthmarks that need to be noted. I'm going to go ahead and run my finger down the spine. And there should not be any holes. And if there is, if you can feel a hole, then that would be a problem that you need to note in the chart. You want to look at the back dimple and make sure that it's closed. The gluteal folds should be even. Next, I'm going to listen to the breath sounds on the back of the baby. And I'm going to do that for a minute in each spot. Okay. I'm going to next pick up the baby and look for the curvature of the spine. So I can rest on your forearm and you can feel the curvature of the spine. Next, I'm going to check the stepping reflex. So you're going to sit the baby up and it should step with with its feet once it stands up on a hard surface. Let me go ahead and lay it back on its back. Next, I'm going to go ahead and look at the arms and legs. So the arms should be equal in length. I'm going to check the movement in all the joints. And they should be flexed as well at the elbows. On the hands, I'm going to check all the hands. I'm going to check for the palmar creases. Nails should be present and to the tip of the fingers in a term baby. And then I'm going to check the number of fingers, which there's 5 on that hand. I'm going to do the same for this hand. Checking the palmar creases and the number of fingers. And for the fingernails as well. I'm going to check the grasping reflex, which this baby has it. Next, I'm going to move to the hips. And I'm going to look for any signs of displacement in the hips. I'm going to do the Barlow and Ortolani test by abducting and adducting the legs at the hips. And you want your fingers on the greater trochanter. The legs should be equal in length. The legs should be shorter than the arms at birth. I'm going to go ahead and check the range of motion in the hips and the knee. Do that for both of the legs. Next, I'm going to move to the feet. You want to make sure the feet are straight and there's no sign of club footing. You want to look at both the feet on the lines on the feet, and the lines on the feet should be closer to the heel. I'm going to check and make sure that there's 5 toes on each foot, which there is. I'm going to do the Babinski reflex by drawing a J on the bottom of the foot. And the toes should flare out and the big toes should extend. It did on the left. I'm going to do it on the right. And it did the same thing. I'm going to check the range of motion in the foot as well. And the joints and the toes. Do that for both of them. And then I'm going to go ahead and check the baby's reflexes for when you drop it, and the arm should flail, like you pick the bed up and you drop the bed that they're laying on, and the arm should flail out and the hand should make a C shape. And that is it for this newborn assessment.